All right, we are live. Hi, everyone. Just making sure we're live. I believe we are. And just confirming if you're here, let us know. Hi, everyone. I'm Dr. Funke Afolabi Brown. It's good to have you here today. I have the distinct pleasure of having Dr. Mariel Paralitici here. And I am just so excited because we're going to be talking about a very important, very important topic. And that's the case of, mental health in teens. It's a big issue, right? Mental health is at an all-time high with, kids, adults. It's been a very stressful season. And so we're going to be delving into more of teens over the next, period of time. And then, my hope is that you'll be able to go away with some just really strategic steps to start to help your teenager who might be struggling. So really good to have you here, Dr. Mariel. Can you tell us a little bit about yourself?
Hello, everyone. Hi, Dr. Funke. Thank you very much for having me today. Yes, I am Dr. Mariel Paralitici. I am an adult, child, and adolescent psychiatrist. I practice in West Palm Beach, Florida. I am a mom of two teens, 13 and 15-year-old. I am also married. And yes, I've been practicing psychiatry since I graduated in 2010 from adult. And then I did another 2 years of fellowship in training in children and adolescents. I did both in New York City, Harlem Hospital Center, in both the residency program for adult general psychiatry and for the fellowship, the specialty in children. And then I worked around 3-4 years in New York while waiting for my husband to finish also psychiatry. He finished 2 years later. And then we came to Florida, and we've been in South Florida since 2014, and I've been practicing since
Yeah, that's
here.
awesome.
Different,
Thank
yes.
you. Thank you so
So
much for doing
thank
this. We're
you.
just so excited. And I'm so excited to also hear that you have teenagers, so you get it and can
I mean,
relate.
yes,
Yeah.
I am in the
Yeah.
middle of the of the eye of the hurricane. Now I am feeling it for every single angle.
Everyone, hopefully not a hurricane at this point, hopefully a drizzle. Our hope is to take the hurricane into a little bit of maybe a drizzle, something of that sort. But
Yes.
first, maybe start off with why is mental health becoming such an issue? I mean, I think it is being a big deal, a big issue with our teens for a while, but I almost feel like it's becoming just more prevalent, more pervasive, and there are a lot more kids that are struggling. Is it that there's an increase in the rate of diagnosis, or is it that it's just more apparent because we're more aware of it?
Hmm. I mean, the exact answer, I really don't know the exact answer but I would say that over the last couple of, I mean, not couple, few years, I think that the movement of mental health
Yeah,
awareness
yeah.
and, fighting the stigma, I think that people are getting it. And I think
Yeah.
that people are getting more open, less scared about it,
Mhm.
which I think it makes it a little bit easier for people to seek help.
Mhm.
However, getting into the access of it still difficult,
Mhm.
although there's more awareness and more
Mhm.
movement out there. And I think the system, it's very difficult in terms of connecting people, but in general, looking in general, um I don't think there are over diagnoses. I
Okay.
think that we are able to pick up more now than before, or families are noticing more often and really going into, let me see, what is this, I'm not sure
Yeah.
where I'm going dealing with, um and maybe asking more questions, people going to
Yeah.
their doctors, being screened more often, then
Mhm.
being connected faster, asking
Mhm.
question to the doctor, doc, and being having this symptoms. it's not something I used to feel before. Can you, and maybe that doctor is the initial step for them to get connected to a specialist. So I think that there's a little bit of everything. But at the same time, there's so many things happening in this world from any single angle. Politics, economic, finances, religion, every single aspect of the world, it's going through challenges. So everybody in certain way are being affected. It doesn't matter how, but they are. And that includes our children, our youth, you know, it's.
That's so true. So, you know, so what I'm hearing is it may not necessarily be that there's an increase in the prevalence. It's just that there's more of an awareness. There's an awareness of, you know, the impact of mental health on overall well-being. And so that is probably making people seek more help, except there is, you know, almost like a funnel, right? Because the access to this to resources to help is limited. The number of, like you mentioned, your field, the work you do, child psychiatry, I mean, there are not that many people that do this. I mean, it just similar to, you know, pediatric sleep, right? They're just very limited resources, and you have a lot more people who are in need of help. But I think that's my hope from this talk. Like when we continue to do work like this, create that awareness through live sessions like this, and you know, other ways to give people information and empower them. There may be strategies they could start to, you know, work on while they're, you know, getting the other resources and while they're meeting health professionals like you. You know, one thing I also wanted to find out, you know, is that sometimes you might have a teenager who is just overwhelmed, overworked, right? Their schedules are packed tight. They're in this sort of pressure to perform. They're, you know, starting to think about college. They're, you know, they're doing sports. They're doing all these things. And so, you know, some of them are just really super high achieving, really, you know, and sometimes it's a fine balance, like what is just overwork and overwhelm versus what is true, maybe anxiety and or potentially depression or other things like that. So what are some just, you know, hints that parents can just be aware of to say, okay, you know what, I think this is just beyond an overpacked schedule. So what are some of those signs or symptoms that may show, okay, my child may be going through some, you know, mental health crisis or struggling a little bit in that direction?
Well, it could be something as easy as just changes that are like just there, okay? Or it could be as subtle as not even knowing that there's something going on. So each kid is very, very different. So each kid, each teen can handle different type of stressors, right? So it depends, okay? So each kid can handle a different range of challenges. It can be simple, can be complex. So here the problem is that you can notice when your child is just tired because they go back to their normal self after some time. Let's say they are overwhelmed during the week because during the week they have their schoolwork plus their extracurricular activities plus studying from this test or homework. They're just exhausted, possibly not even having enough sleep at night, then waking up very early, going through their day. Battery wise, they're just draining, right? But it comes the weekend and then they find themselves back, or they're just having their normal activities, going to their, I'm sorry if my dogs are on the background, they're just off. So sorry for that. Let me see if I can mute my background here. Hello. So, you know, it depends. If you see them going back to themselves when they have the time to, after they rested, or it's okay, that's normal. It's like an adult who are going through, you know, a full week of work, and then the weekend comes, they drain, they reset, and they are back to their norm. However, a kid or a teen that it's really struggling, you're going to notice that when, you know, they're overwhelmed, they are tired, but they continue with this type of externalized behavior down, let's call it. And gradually it keeps going even worse to the point that they start decreasing some of their functionalities in life. It could be as their students, they start decreasing their grades, or now their behavior at home is totally different from what they used to be. Maybe from this social, outgoing, friendly kid, now I am isolated, always on my own, just not doing the same things I used to do before. So, as a parent, you know your child. So you need to pick up those red flags because new behaviors, when they externalize and they have new behaviors, can
Yeah.
be the same worrisome as behaviors that are no longer there and they used to be, like being friendly and social, and now I am isolated and withdrawn. So those shifts in behavior from your kid that it's not the same. He's just
Yeah.
always simply, those things are super red flags. Kids that are that they used to be open and talkative and now they don't talk too much, or
Yeah.
kids who are pretty shy and now they're saying and expressing things that are
Yeah.
pretty concerning, negative thinking, pretty negative expressions about themselves, or people doesn't like me, mom, I feel nobody really likes me, I am alone at school, different things. Their appetite changes from normal eating habits to either too much or restricting and not eating. So
Yeah.
those are red flags. Sleeping sleep pattern changes from
Yeah.
someone who used to sleep normal 7, 6, 7, 8 hours to someone who is not sleeping at all, or maybe a
Yeah.
couple of hours. The next day, they are totally tired, exhausted, and possibly moody.
Yeah.
So, many things that we have to take in consideration, but number one, it's the safety. Those behaviors that were not there and now they're there, and now it's more impulsive or very internalizing behavior that they are not really themselves at all and making concerning statements, red flags to do something else other than just observe. um,
Yeah.
Important to ask and communicate with them, is there something different, something going on, because they tend not to really talk too much.
Much.
And
Exactly.
if we don't ask or initiate, they won't do it. Okay.
Yeah.
And there's physiological reasons of why they are the way they are. So yes, it's as parents, it's just being always on the loop and watch, because these teenage years are so unpredictable.
Yeah. Yeah.
That's the word. It's unpredictable because of the impulsivity of our teens. They
Yeah.
are by default impulsive. They are not good decision makers,
Yeah.
people, because of the stage of development of their brains. So we have to be careful and just not ignore behaviors that we know they're different, because those behaviors can keep developing into something more severe or more complex, and then it can be more difficult to get out of that um, mood or challenge moment.
Yeah.
So yes, yeah. So it's really, really being there,
Absolutely.
and
It's incredible. It sounds
and
like, just really being very aware of changes in your teen
yes,
and navigating what's just your typical or moody teen versus, okay, this teen is things are going, the child is changing. It's not just external stressors now, or it's going beyond that. That's what it sounds like. And sometimes you may
definitely.
just feel like, oh yeah, he just wants to spend some time alone and it's okay. But if that's what they're constantly seeking, then it might be a sign that, okay, let's have a conversation. And I love what you just mentioned about conversation. I think really not making it, one, not trivializing what they're feeling, not minimizing it, and also normalizing it to some extent. Like, yeah, it is it is, you know, normal to feel like you don't want to talk to people. But when you're at a point where now you're constantly seeking isolation, or you're constantly having difficulties with self-regulation, that may be a sign that, okay, we may need to really delve deeper into this. And one
Yes.
of the things that you mentioned that would probably lead me to my next question is the fact that sleep and, you know, anxiety, sleep and depression, they're so intertwined. And sometimes people say, you know, which came first, the chicken or the egg? Is it that they didn't sleep well, and so because of that, they're moody and they're sad, and they're, you know, and they just have apathy and lack of motivation, and they just have difficulties again with self-regulation, and they feel very anxious? Is it because they didn't sleep well? Or is it that they have the symptoms where they are hypervigilant and they feel overwhelmed, and so because of that, they're not sleeping? And one thing I also wanted to mention, just really to get your insight into that, is the fact that sometimes your teenager who may be struggling with maybe depression or other mood issues may actually sleep too much in that sense. There's this feeling of just really wanting to just lay and do nothing. So if you're seeing that as well, for me, that's always a sign to, okay, let's delve into what else is going on. So
Yes,
just want to hear your thoughts on that. Yeah.
but as everything, you know, moderation is the key.
Yeah.
Everything in excess can be
Yeah.
dangerous, you know, and as well as sleep, as
Yeah.
drinking water in excess can be
Yeah.
dangerous.
Yeah.
So yeah, moderation and looking for those patterns, as you mentioned, because if these teens were not normal sleepers or sleeping, you know, and now they're sleeping 10, 12 hours every day and having, so those are red flags as well. But as you mentioned, there could be so many factors, and which one came first?
Yeah.
So, I mean, who knows?
Yeah.
The egg or the chicken, right? And that's why it's very important, you know, an evaluation. In the evaluation, you know, we have to do so much mental timeline work.
Mm.
So while we are asking this question, we are making our own map on when this started, events that happens before, during, or after, just to
Yeah.
try to figure it out and put this puzzle together to figure it out myself if this is primary or secondary.
Mm.
It's very difficult to come to a like 100% guaranteed response in an hour or 2 hours or evaluation. So to get into a proper, you know, diagnosis, I think
Yeah.
it takes time when you really know the patient. It's really hard to come up with diagnosis like schizophrenia, bipolar disorder, just by 1 hour, hour and a half, 2 hours of evaluation. And we have to do that because of how our system works, right? So it I think we have gotten into the we developed the skill to do our best in
Mm.
such small amount of time to
Yeah.
try to help our patients to figure it out. However,
Yeah.
many things going on at the same time. So environmental factors are uh, 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 possibilities, you know, reasons of genetic factors,
Mm.
biological or medical, right? And also our developmental stage. So when we put a child, an adolescent, or an adult all together and we start comparing their degree or their symptoms of depression, you'll see, or anxiety, whatever we're talking in mental health, you will see a very different manifestation of symptoms.
Yeah.
The way they externalize or manifest their symptom can be very, very different. And one of the reasons it's the way or the stage of development their brain are. You know, during during the teenage years, it's when the brain is in fast mode of development, but it's not close to be fully developed at all. You know, that
Mm.
happens in mid-20s or something.
Mhm.
So all these years, our brain is developing, so we can actually, not we, so our body over time, our brain over time can process all the hundreds and millions stimuli that we get processed into proper rational information. But that happens on a mature brain, right? Our kids and our adolescents have an emotional reactive brain. They don't have a rational brain because the prefrontal cortex, which is what actually make us make choices, and it develops our character, our personalities, our executive function. Adults totally developed. That's why we can look further, we can comprehend, we can go into complexity. Our teens cannot. Our teens, those processes are really processed through their amygdala, which is the emotional response of their emotional response center. So when they get information from the outside and they process, instead of processing it the correct way, they just process it emotionally. The first thing to wake up, it's the amygdala, which sends some sort of fear there. And most of our reactions in this age, it's impulsive, fearful, it's kind of anxious, that fight or flight response. Their heart goes off, their breathing goes off, no lack of oxygen in their whole system. Everything is in stress mode. So they don't think clearly. They just have to choose what to do without really processing safety. What I'm doing is this consequence. They have no idea of what is cause and consequences. It's like there's no way to, they don't have the time to process that. The thing is that most of these things happens while we're sleeping. So this development and this myelination or creation of new neural pathways. So these different systems can communicate into each other, and now the emotional brain can process the rational brain. You know, that's the ultimate goal of our brain development, is to be able to integrate both. And at the end of that integration, we have a better positive response to stress because we were able to integrate the adaptive input that we got. We process it correctly. Now we consolidated everything in our sleep. We have memory, we have that experience, we associated, we integrate, and then later on we can have a better positive response. In teens, they lack all those steps and they just go immediately into fight or flight. Let's go. Let's just survive. So that's why impulsivity is just a default reaction on teenagers. And when we have a mental health issues and all these functions are limited due to either the developmental stage or other challenges going on, you know, it's a big gap. It's a big gap for them to be able to really see the puzzle again at the end. So it's like starting again. They're just like open lines of current. They can just explode in any minute, but if you actually put it together at the right moment, the right time, they are gonna do well. So, you know, development, it's crucial, and sleep, it's a crucial part of this development, so our brain can develop healthy. And when we have similar experiences later on, we can we have that integration done in a healthy way, that we can choose, or we can actually respond the rational, proper way that we could, versus just whatever happened, it happens. And then most of the time our teens regret because they didn't think, you know.
Absolutely.
So
no.
it's a very complex subject, but
I know it does sound like it. It does sound like it. And there's just so much to unpack with that. But, you know, I think one of the things that we're taking away is, you know, it's not just once, there's so many factors that can impact your child's mood and emotional well-being. But one of the things that we can use as a tool, whatever the direction of what is causing what is prioritizing sleep, right? And I love that you brought that up. I think it's really important that we do get them sleeping well, getting restful sleep, getting the right amount of sleep is about 8 to 10 hours. That's the goal. But, wherever they are really building up to it, I think is really important. And, I think this has just really been so informative but for the sake of time, I think what I would love for us to finish up with is, while parents are working with their teens to make sure that they are getting sufficient sleep so that they can benefit from those neural consolidation, connections and memory consolidations and emotion regulations, what other ways, what are maybe you could give us three just for, as we round up, 3 ways that parents can support their children's just mental and emotional well-being, granted that, of course, trying to make sure that they practice healthy sleep habits. We're working on that on the side, but what are other maybe 3 that you could give us that parents can help with supporting their children? And what are signs that they need to probably seek help outside, see a therapist, see a psychiatrist, maybe consider medications? I know it's a kind of twofold question.
Yeah. I mean, so the first one is the strategies for parents to give to help support their children, right?
Yes.
So I would say, teenage years are very difficult times for them, the school years, and I see that school, it's a big, huge pressure for them. I mean, I don't know, there's so many different programs and so many different things and ways to go now in school that the system here, I think, already gives them a lot of overwhelming stress about so early ages, already focusing on different. So the stress for these kids already there. So one of the things that I tell parents is like, understand that only they are fully handful there. So giving them the opportunity to decompress at home and having their own time. They need some time to rest when they come home. Yes, they need to do their homework, they need to do their stuff, but they need to do activities that really, really make them feel themselves good.
Perfect.
And that it's not really obligated, something that I want my child to do, it's not something my child will love to do. So knowing what your child love to do and letting them enjoy that time, it's very important, because that time, it's also a time for them to start developing their own identity. And the more they do the things they love to do, this positive neurocircuitry also keep, increasing. So letting them be themselves. Okay, of course, not letting them too much, because they can go too much, right?
Absolutely.
But giving them time, of course, talking to them, let them express their feelings. If they are not really open to you, don't feel bad if they don't want to talk to you. That's totally normal, even for myself, because I think that because I am what I am, my kids are going to talk to me. No, wrong. It's not happening. So give the option to have somebody there. It doesn't have to be mommy or daddy. It can be a trust adult or someone who they feel good about, and that they, of course, they need their privacy and confidentiality, and try not to um, cross that boundary with that person, because they want privacy. Parents, that's something that they want. So you can be there and support being there without being there, but they need their space. But I think the most important part is try not to overwhelm them, because if we try to overwhelm them, they're going to feel that we are another source when we really try to help, but we're not helping. And they feel more, more, frustrated. They go more to their room. But it's by default. They're going to be talking back. They're going to be throwing door. They're going to be those moments up to what is the limit of what is normal. Okay, this behavior every day is not normal. Behaviors that passes the boundary are the norm. That those red flags are okay. This is moment to move forward and see if I need to seek more help before going to someone like me, which is I'm a child psychiatrist. When you go to me, it's because you have tried most of these strategies and skills and possibly already therapy. Not really. People go to the psychiatrist jumping every single step, okay? And I am the one who start, hey, but we need to try non-invasive alternatives first, because many of these things can be fixed by just tweaking certain things in our life. But most of the time when this decline in functioning, it's pretty severe. And now there's a significant decline in class or a significant decline in the way they behave at home. And now I am concerned about safety and other areas. It is a moment to discuss with the pediatrician, with your therapist if you already have one, and maybe go to a next level. Okay, we need to rule out medical causes of different conditions that can look like depression or anxiety or behavioral issues, ADHD, inattention, because there are other things that can look like, but it's not. Okay, so there are many things that we have to do to rule out and rule in before we actually say this is it. So it's very difficult to come up with a diagnosis and problem day one, but we will get there based on response and treatment. Family support, family education, and understanding that the whole family needs to help this particular patient. It's part of the treatment. Everybody here is involved. It's not only mom, dad, and the kid. It's mom, dad, grandma, everybody's involved. Brother, sister, auntie, whoever lives in your household. And I mean, it's, again, every kid manifests different, expresses differently, shows themselves differently. As a parent, look for those red flags. And if you don't know something, call someone. Start from your best friend or neighbor or husband. If not, call your pediatrician, because at this age, everybody should have a pediatrician. And from there, we keep moving on until we will get there. You get there. It's easy, not as easy to get connected immediately, but starting the process of asking for help, it's pretty easy. And the journey, it gets easier once you start getting all that team together and feeling more comfortable and understanding the whole treatment plan. It's smoother for the family. It makes it easier for the child. They understand they're not the only ones going through this, and they are not different as they, often feel. So, it's a journey, but it's doable. And I think that the most important part is trust your doctors. And if you don't trust them, look for another one. Go for that second opinion. You cannot leave that room without questions unasked. And if you did leave, it's because you did not ask.
Thanks for bringing that up. This is so helpful. So it sounds like find opportunities for them to distress, encourage them to find activities that fill their cup, not just the ones you suggest. Create opportunities for conversation. It might not be with you, it might be with another trusted adult, but really making sure they have an outlet. And also, seek family support and do not hesitate. I think the first place, even if there's nothing and you have any worry or concern, just reach out to your pediatrician. They're always there to help guide you and say, okay, you know what, maybe there's more to this. And I think that's a great way to really round this up, to say that your child should not struggle on their own without help. There's a lot of resources out there. I mean, some are more appropriate than others. Some may end up causing more confusion. So you do need to do your research properly, advocate for your child's needs, and teach your child to advocate for themselves by empowering them, by normalizing just, the ability for them to express themselves, right? So don't make them feel like they're different because they feel anxious, or they're different because they feel constantly sad, because this is something that, can be addressed with a lot of help, therapy, sleep, treating
Yes.
underlying medical issues, so many options. So I think this is perfect. And this has been really, really informative. Thank you so much for hopping on here and talking with us. But then where can people find you if they do want to work with you?
So I work, as I mentioned before, in West Palm Beach County, Florida. So that's where I'm located. My website is www.psychiatryboutique.com. You can find me in Instagram and Facebook, educational things about mental health. Instagram, Dr. P _ Psychiatry Boutique, Facebook, Dr. P @Psychiatry Boutique, and also in LinkedIn, Mariel Paralitici-Morales MD. Those are,
Awesome.
yeah.
Perfect. And I'll put the links in here in the notes and, the comments as well. And really, really thank you so much again.
Thank you, Dr. Funke.
Oh, no, it's been such a pleasure. So if you do have teens who first, they are struggling with sleep, and again, one of the things we talked about is sleep being a fundamental tool for them to just feel better, right? I talk about sleep helping us be, happier, more successful, and to live healthier lives. And so our teens as well matter. There's a Sleep in Teens course that I created. It's on my website. You could grab that. www.restfulsleepmd.com/courses. And so this is a self-paced program or course that your teen can actually take part in and learn about their sleep and learn about the importance and learn about why their sleep might be different at different stages of life. So I do encourage you to use that resource. Definitely check out Dr. Mariel's website at psychiatryboutique.com, especially if you're in the Florida area. And so I hope this has been helpful. If it has, definitely share, comment, like it, let us know your thoughts. And until next time, I hope you all rest well.
Thank you,
Bye.
Dr. Funke.
Oh, you're welcome.